So her skin is, I would say, pinkish tan. It's consistent with her genetic background. There are, she has some brown freckles on her cheeks. And I probably should measure those. I didn't bring my little thing with me, but.
But for the sake of our checkoff, we'll just say, you know, like I would measure a document this size, this,
You can,
whatever.
yeah, that's fine. That's fine. You can do that. Or else you'll be there forever measuring things.
Yeah.
And I mean, they're just like
Every little
freckles.
freckle.
Yeah. The skin's intact. Okay. I don't see any lesions. Next, I will go to hair. Okay. Her hair is brown. It's a fine texture. Okay. It's not, her hair doesn't look, it's not dry, so it's, moisture is appropriate. I look at her scalp. I'm just gonna, and I won't do your entire scalp, but just gonna look a little bit through. I don't see any lesions on her scalp. Her hair, and you want to mention hygiene also, so hair is clean. Okay. And also no infestations. And then I'm just going to palpate her scalp, palpate her hair and her head, rather. Okay. So head is round. It's symmetrical. That would equate to being normal cephalic. Okay. Next, I'll do face. Go ahead. I'm gonna check her facial nerve, which is it will be cranial nerve 7, and I want you have to name it as well as say the number. So go ahead and smile for me. Okay. Puff your cheeks. Frown. Okay. Cranial nerve 7 is intact. Now I'm going to just feel her sinuses, frontal sinuses.
To check the cranial number 6, what do you do here?
Oh,
You do 7 and 5 on the thing.
Which
7
one?
and 5. So for the face is 7 and 5. So we just did 7.
Okay.
And she'll do
Okay.
5.
And then
Cranial
5 is the jaw, right? 5 is trigeminal,
number
the jaw clench, and also
I changed
the
the-
So we'll do that now. Let me get a we use a cotton ball for that. So clench your jaws. So this is cranial nerve 5, trigeminal. Clench your jaws.
Oh, okay, okay.
See if they can feel
Okay.
those sensations.
Go ahead and close your eyes for
Oh,
me.
right here, okay, thanks.
Can you still clench my jaw? No, you can look. Okay. Close your eyes. Where do you feel me touch it?
Right here.
Right here. So we say that cranial nerve is intact. 5 trigeminal nerve is intact. Now I'm going to palpate sinuses. Just looking. There's no swelling, no redness. Tell me if you have any pain when I palpate.
I don't feel anything.
All right. So since I'm still at the face, I will palpate next her temporal artery, and you can do that in front of the ears or right around here. It runs up the side of the face, so either position is fine.
So we just need to say that we feel her pulse, or how do you want us to, pulse or positive? Simple pulse.
Right. You don't have to grade them at this point. You will be grading them later on to get to cardiovascular.
Okay.
But at this point, just say temporal pulse palpable.
Palpable.
Yeah.
Okay.
That's all you have to do.
Okay.
Okay. So you can do it here, or either you can do it right in front of the ears. Feel it both places. Next, I am going to do the eyes. So first, I'm going to, we'll do cranial nerve 3, 4, and 6. That would be oculomotor, trochlear, and abducens. And we'll check the extraocular muscles, or EOMs, with that. I'll just have you first just follow this, follow my pen. I'm not going to plan, but just follow it. Okay? Both eyes. And what I'm looking for is that both of her eyes follow this pin. when we're in the lateral position, there may be some nystagmus, which is normal in that position, but otherwise you shouldn't see any twitching of the eye. Okay. So just follow.
And that's the EOM?
That's right. Cranial. With that, you're testing cranial nerve.
Oh, okay, all three.
Right. Ocular motor, trochlear, appusis.
Do you want us to actually say when we're like going up, whether it's, ocular or, you know what I'm saying? Cause
No, you can just tell me beforehand that's what you're doing.
those three, okay.
Yeah, you can tell me you're testing those three when you're doing that particular test. Another one, another test for EOMs is the corneal light reflex. Basically, what you do is shine the light at the bridge of the nose, and I should see the light at the same point in her corneas. This is going to take me more than 15 minutes because I'm talking. Maybe I shouldn't be talking while I'm doing it.
No,
No, that's okay.
That's
Okay.
explaining.
Okay, so we're going to shine the
we're
light.
not timing.
Shine the light at the bridge of her nose, and the light should reflect from the cornea at the same place. And this is checking EOMs, this is checking alignment, okay? So, I'm gonna shine.
We were doing
It's
this
kinda
today in
weak.
clinical and it actually is really cool. You see the light.
Does anyone have a pen light I can borrow maybe? I don't know, my light doesn't seem very.
This is yours. I thought it was
Do
mine.
you wanna use mine?
Kinda weird.
Thank you.
And you do it from
Volunteer
about,
stuff.
roughly about a foot out. Okay, just look straight, okay, just look straight out the
Alright.
wall. So. I don't know if you can see from where you are, but the light is shining in the same area of her cornea. And you remember the cornea is the covering. I just shined at the bridge of her
At the
nose.
bridge of-
From about a foot out, about at the bridge of the nose, and you look for, you wanna come over and see? Okay. The cornea, remember, is the covering over the iris and the pupil.
Okay.
So, shine at the bridge, and you see the reflection? It's like, I'd say probably at about 2 o'clock.
See that?
You see there? Okay. If that was abnormal, and we're just gonna do it for the sake of the test, you do another test called the cover-uncover test. And I'll have you look again straight at the wall. Okay. Now, you don't see, she's just kind of stare. I'm gonna put a piece of paper in front of your eyes, just continue to stare.
Okay.
All right, so, just watch her eyes. We're gonna cover. She's staring, remove it, and she's still able to stare. So, we were looking to make sure that this eye didn't drift.
Okay.
Okay, her eye, they're
So
in
we have to do
alignment.
that one as well, or?
Yes,
Okay.
but just know that in practice, it would be
Oh,
like a
sorry.
two-step thing. You wouldn't necessarily have to do it, but just for the sake of the
Oh,
test.
so we
just
should
do
just say, once we've done that, we should say eyes are aligned?
Eyes are, you can say, because that also tests the ocular motor,
Okay,
so you can just say the cranial nerves are intact, and you can tell me that the eyes are in alignment, that's fine.
okay.
Okay, next one we'll do is peripheral vision. Let me just have you stand up for this one. Okay. Cover, just face me, cover one eye. This is, actually I should give you. And you don't, just know in practice you do both sides. You can just do one side for the test, that's fine, but just know you do both. So what I want you to tell me is when you can see both of my fingers, okay?